So I am Laura Werts. I am from Cincinnati Children's Hospital, and we are actually coming to you from our from our conference room, and we're glad to be here. And this is
Hi, I'm Suzanne Matthey. I'm from the University of Cincinnati CME office. And like Laura said, we're sitting over here at Cincinnati Children's to do this presentation.
all right. Hopefully it doesn't give you whiplash as we go back and forth. So we have nothing to disclose as any good CME professionals. We have to start off with that. We are really looking for this time to be practical. We want this to be able to actually be able to meet whatever needs that you have. That's the reason that we actually started using AI in the first place, was to actually help us manage kind of the day-to-day of what we have to do in a more efficient way. We're going to be as interactive as possible. When we did this in person, we asked for people to put your computers out and actually, kind of play around. Knowing that this is a Zoom webinar, if you want to, in the background, we're going to be using two primary AI platforms, ChatGPT and Perplexity. So if you want to have those up in the background and kind of play along as we're teaching, great. Be active in the chat. Melissa is going to help us monitor that. We encourage you to ask questions as we go along, and then we'll try to address them as they come up. And Melissa, if you see that we're missing anything, please take yourself off mute and go ahead and just put those questions out there. And we do ask that you use, if you're familiar with Zoom, use the hand raising function to make sure that we don't miss anybody. So our other disclaimer is that AI is constantly changing, and we are all learning this as we go along. So if you have anything to add with what we're saying, or you had different results, again, put it in the chat. We are all learning this kind of at the same time. Kind of fun and scary. And Suzanne is going to go over just a little bit of the basics of AI.
So AI is artificial intelligence, refers to a computer system that takes tasks typically required for human intelligence. You type something in and it'll process what you're saying, 100 times faster than a person. And again, AI was used to help create this presentation. We simply put in one of the platforms, how do I give a presentation on AI? What should I put? What should I do? And it comes back with suggestions. You'll see throughout this that you don't want to take AI at face value. You have to verify everything. It is a computer system. It does have hallucinations. And when I say hallucinations, I mean it gives you false data. People created this, so whatever information has been fed into AI is what it's referencing. It does evolve on its own, which is kind of scary, but it does learn too. So, okay. We've got different kinds of AI, predictive analytics. You can use for forecasting, future trends, behaviors, machine learning, algorithms that improve your experience, natural language processing that enables computer to understand and generate human language. If any of you are into IT and or coding, you will know that natural language is not so natural. All right, now I think we're going to do the room check. I think that's you.
So we want to do a little bit of a check here just to see the experience level that people have. So if you could put in the chat how often or how familiar you are with AI. If you rarely use it, periodically, which we're defining as 2 or 3 times a week, or daily. And Melissa, again, if you could let us know what people are putting in, that would be great. Oh, actually, I see the chat here. There we go.
Yeah, looks like you got a lot of rarelies.
Rarely, periodically. Oh, I like Joe is very specific. He's used it 15 times in total or 15 minutes in total or 15 times. Never, rarely. Okay. Well, this is good to know. So we will try to be maybe a little bit more explicit in our explanations. So that's great to know. There we go. Come on. There we go. So we're going to, like I said, we're going to be talking about two platforms primarily, but we did want to go over just a few. So Copilot is one that a lot of people are going to have access to. If your offices have Microsoft products or the Microsoft suite, almost all of them now have also like purchased the Copilot. I'll be honest, when Copilot first came out, I did not use it that often. I didn't think it was that great. It has gotten better very quickly, I have found. I think you have too, haven't you? Yeah. The good thing about using Copilot, if you're using it through your organization's login, is that you can share information a little more freely and you don't have to scrub your data. So I think both Suzanne and I, if we're using either Chat or Perplexity, we scrub our data before we put it in because we don't want anybody's name out there that they have not given permission for. You don't have to worry about that if you use Copilot and you're logged into your institution's license. ChatGPT is very conversational. I use this a lot for editing and I use it a lot for analysis, which is what I'll show you. I find it to be a really, really good copy editor. It is more prone as the official language is hallucination. Basically, it lies. So it doesn't ever want to tell you no. So if you ask it a question and it doesn't actually have the answer, it's very prone to just make something up. So I call it the people pleaser of of AI platforms. Perplexity, it does have that conversational model. However, and you'll see Suzanne's going to do the first demonstration for that. What's really good about Perplexity, it shows you where it's getting the information from so that you can actually log on to the website and make sure if you think it's from a valid source or not. So we use it a lot for mitigations, for financial mitigations, and for content validation. Basically anything where you need to be able to see where the resources are coming from. And I'll be honest, I also use it a lot. The ACCME's website, I find, can be a little hard to find information that I need. A lot of times I'll just use Perplexity and say, can you pull this from the ACCME's website? And it takes me directly to the page. I don't know if you do that, but I started doing that a lot. Some other platforms just to kind of be aware of, there's Canva, which is what a lot of people use for education development. Claude is one that's starting to get used a little bit more. Descript is good for video editing. Gemini works with Google products. That's a little bit, I think, again, these are all getting better, but I don't think it's massively popularly used yet. There's a transcription service called Nada. Otter AI, a lot of people use. You can set up an Otter account, and if your IS department lets you, it can log in for you for a meeting and take notes for you. So there's some benefit to that one too. Our IS department does not allow that, so we're not able to use it, but it does have a lot of good features to it. Unriddle is one that we've been looking at. It's for academic and research writing assistant. It's evolving. We actually have a small group here at Children's who's kind of looking at some of these. The professional opinion is it's not ready for prime time yet, but it's got some possibilities. Our preferences, again, the Copilot, because both of our institutions have a paid for version. Through our enterprise license. So we use that a lot for security reasons. I have a license that's, there's different levels that you can get through enterprise. The level I have allows for transcriptions and meeting summaries. Love that feature. I use that all the time. ChatGPT, again, we use for written summaries, copy editing. We have a paid account. And basically it just means you can upload a little bit more and it goes a little bit faster, and you'll see. Perplexity, again, is great for reference materials. We both use it for mitigation. UC has a paid account. We do not have a paid account to Perplexity. I think Suzanne can do a little bit more and a little bit faster. It still works okay for us. The demonstrations that we're going to show, oh, sorry, the prompts, I forgot. Suzanne's going to go over just kind of what makes a good prompt. You might actually want to say what a prompt is too.
Yeah. Okay, so when we're talking about prompts, it's basically asking what you want. So a prompt would be something, here is my resume, or here is a candidate's resume, here is a candidate's job description. Is this candidate a good fit? So you can plug in information, and it will come back with things. Say, oh no, they're not a good fit because they don't have these specific job qualifications, or they are a good fit because they do. Different, as you're doing this and you put in a prompt and you ask questions, if it doesn't give you what you're looking for, you then add another prompt, ask it another question. I kind of look at it as just talking to another human being. I didn't understand that, explain that again, or explain it for a first grader, and it'll really dumb it down for you. And honestly, that's how I learned most of the AI. I went in trying to break it. That's something I like to do anyway. I want to see if I can stump AI. So there's different things you can ask. And it'll vary depending on what you're doing. In regards to ACCME and CME credits, you ask very specific questions. Let's see, if I have a speaker, here's the disclosures, and then I put in something along the lines of, does anything in this speaker's disclosure disqualify them or go against any ACCME policies? And I will also add in there, please use accme.com as your main reference point. And you'll see that when I do the example, you'll see the sources coming up, and there are links that you can click on, so you can easily verify. That's why I prefer Perplexity. Let's see. Okay, so where was I going with that? One of the things, like how I said, use ACC as your primary reference. Another thing you can say is use Bloom's taxonomy to help with objectives. That's actually a really good one. We provide that as a reference document when we send out our applications, so that our partners know this is pretty much how you should write or not write your objectives. You do want to give it clear direction. Again, if it's not producing what you think it should, ask it another question. Just think of asking another person. I'm looking at our slides.
I mean,
oh, if there's something you don't want it to produce, ask it not to include that. You can ask for tables, you can ask for charts, all kinds of different things. And depending on which platform you're using, depends on how good the information you get back. Some platforms are better than others, producing tables and different characters and whatnot that you can use within your presentations. And there is no one way, no one right way to work with AI. Like I said, you write to it like you're having a conversation with a person. You do want to scrub all the data, so no names, birthdays, IDs, anything that is personally identifiable or proprietary information. You absolutely do not want to put that in unless you have the license with your company and you know that it's safe. Another thing that people don't realize, and it took me a while to learn this, is as you're typing things in to the prompt, sometimes it's easier to see what you're doing and understand what you're doing if you're putting spaces. However, if you hit the enter key, it's going to ask whatever you have in there. So if you hit shift and enter, it'll give you a new line. It's a very helpful step. And the first step is taking the first step. Try it. I mean, it's not going to make fun of you. It's not going to judge you. It is truly a wonderful tool. Okay.
This is just showing what we're gonna go over.
Okay. So here's some different things that we're going to go over. Laura, like she said, is going to do some of the summarizing and analyzing data. I think we both have a mitigation in there. And then checking for bias within presentations. That one can be a little bit more tricky. It involves either uploading or scrubbing and uploading documents or taking snippets from documents and loading it in there. You can also do marketing materials, help with the wording. I'm not wonderful at writing emails, so I run almost everything through ChatGPT and I simply ask, how can I word this email better? And then I copy my email into it. And it will come back. Grammar isn't wonderful on it, but it's getting there. But that is one of my favorite things to use chat for. Okay, so now we're going to go into the mitigation.
Yep, so this this is yours.
Oh, okay.
So what we're gonna do now is we're actually gonna go into, I'm gonna actually look in the chat real quick and just see if there's any questions so far. Okay, so what we're gonna do is we're actually gonna go into the platforms themselves and show you how we use it. This is gonna be the bulk of the presentation, is actually showing you how we use it. So we've already got them up, and the first one we're gonna use is Perplexity. And I am going to show you, we'll give this to Ruth and she can send it out afterwards. What we've done is we actually put all of our prompts on a Word document for ourselves so we can refer back to it. We did not immediately come up with how to write these prompts. Like, this is trial and error on our part. So don't feel like when you start that this is the level that you're gonna start at. Neither one of us started by doing these very long prompts. We started with, here's a speaker, is it biased, and we, through, again, as Suzanne said, through trial and error, we learn. So Suzanne's going to actually go through the first one.
Okay. Go. Oh, there it is. Okay. Okay, can I move that? Oh, there we go. Okay, so in this instance, I'm looking at a speaker who's going to be presenting at a conference, and I want to know, is there anything I need to do to mitigate this speaker's disclosures? So you can see I've got a very long prompt here. I ask why not? Does the organization have a parent company? So a very, very long prompt. And as Laura said, that's not something you're going to start out with. You're going to just start with the basics and you'll work your way up to this, to whatever's comfortable for you. Let's see. Oh, that's not what I wanted to do. There we go. So in this very last line here, you can see I'm saying, look at ACCME. Make sure that your response coincides with what they're asking. So, all right, how do we get back? There we go. Okay, so this is Perplexity. This is a paid version that I use. So all I did was copy my prompt. Oops. And I pasted in here. And if you wanted to attach, we could attach the document with using the paperclip. But I'm going to hit enter. You're going to see all of my wonderful prompt. Okay, so as it's starting to answer, it's building its sources. And as you can see, if you hover over them, it'll give you a little bit more information. They're actual links. You can click on it. It'll take you, well, probably shouldn't have gone to that one, but it'll take you to the site that you click on. Then, okay, so here it's just saying based on the information that I provided, it's analyzing the eligibility status according to ACCME guidelines. And I'll kind of just slowly scroll through this so you can kind of see what it's giving. Again, the numbers down here, it's just like citing in a paper. It's telling you which source it's coming from. And again, clickable, which makes it very convenient. And then in the prompt, I had also asked it to make a summary table. So it's very, very easy to read. And you can specify in the table which, what criteria you want it to show, as far as columns and rows, and it'll come back usually pretty good. Sometimes you have to ask it a couple times. So here, let's see, based on the analysis, 3 companies appear to be ineligible companies according to ACCME guidelines. So at that point, I can go back in and ask, I'll just type this one. How can, if I can type, mitigate this speakers. I can't see the keys. Disclosures. All right, now it's going to think. And then here it'll give you some mitigation strategies. Again, you'll want to read through all this. It's not gospel. It doesn't mean it's 100% right, even though I'm paying a service to have this. So you definitely want to verify. Never, ever, ever copy and paste exactly what you see. One, it sounds mechanical. My boss can attest to that because I'll send her emails that I've put through chat and she's, oh, that's a little mechanical. You might want to humanize that just a bit. But as you can see, it came up with quite a few things to help mitigate. And then it'll also give you prompts if you want to continue on. How does the ACCME define ineligible companies? So you can click on that. It'll take you to the next step. After every prompt and every answer, you're going to get a list of different questions. You don't have to click on them, but something might pique your interest. Here's the next set. Let's see. How do I go back? Oh, not that. You got me lost.
What are you trying to go back to?
The Word document.
I don't know.
Okay. So that was our first prompt. Actually, I think, yeah, this is mine, okay. Bruce Banner.
Okay. Oh, that's it.
So I feel weird when I put things in and ask questions, even with AI, without having a name. So I like Marvel, so I use Bruce Banner. It doesn't matter how you do that, so long as you're not using the actual name. So a little bit what I'm doing here. So I'm asking again about disclosures, ACCME standards. Here's the speaker information, information about the content. And I've got the title in there. So I give it a whole lot of information. Oops, I don't want to do the follow-up yet. What do you hit shift to switch your screens?
Oh, Alt tab.
Alt tab. Okay. All right. So I will go ahead and paste that giant thing in there. Okay, so this is doing the same thing. It's going through the information that I provided, saying you should probably have a peer review for this, content adjustment, transparency. There, I mean, literally it goes through everything. And what'd you say? Alt tab?
Alt tab.
Oh, there it is. Yeah, that's nice. Okay. So here I'm going to ask it a follow-up question because I'm not sure. Can this speaker also serve on the planning committee without violating any of ACCME standards? So where'd it go? You missed it. I missed it. This is why I have giant screens, so I can see everything. Oh, there we go. Okay, so we will paste that in. Okay, so it is based on the information that I gave it, it's saying that Dr. Bruce Banner should not serve as the planning committee course director for this conference. And then it tells me why. So it's going to go through everything. Again, you want to read through this. You do have to kind of cherry pick the information that you need as you go along and you start to learn the different prompts and things to ask. The information will get better as you're learning, so is the AI system. So give it time. Don't think everything, you know, if it doesn't come back the first time the way you want it, don't think you didn't do it right. Let's see. I don't know what I just did.
Clicked on there. Let's get off of it, shall we? There we go.
Are we still in?
Yeah.
Okay.
Okay. So we're gonna, I'm gonna take just a minute to check in and see if there's any questions in the chat, and also to see, is this helpful for you? Is this the kind of stuff that you were hoping to see? Looks like somebody has their hand raised. Joe.
Yeah, so thank you. This is very interesting and well done. I've played with Chat GPT a few times, and it is pretty neat, no doubt. Do you recommend that we use this if we do not have a formal subscription, or we pay for it? Just
Like without the paid version?
yeah.
Yeah, absolutely. I think like I said, I don't have a paid version of Perplexity. Suzanne has it on my computer just because I logged in for us to do this presentation. But when
Yeah.
I use Perplexity, I don't have a paid version.
Right.
Again, I just make sure I scrub the data.
So
That's the part.
can we ask Chat GPT, is it okay to use Chat GPT when we're scrubbing our files for conflicts and all that? See what it says. I mean, you still have to read everything, right? You still have to do.
Oh yeah, you still have to with the things. I think my part 2 presentation I want to do is what AI should not be doing.
That's
So,
good.
and one of the things that AI should not be doing is being the only source of your research, right?
No, I think, yeah, that's an excellent topic, like what you should not use it for. That was
Exactly.
more important. And I think, I like the way that it lays it out and,
Yes.
numbers and all that. And then, that could be,
Perplexity is very helpful that way.
okay. Yeah,
Yeah.
that's interesting. Okay,
I've
great.
actually started using Perplexity a lot in place of Google, depending on what I'm looking for, because one of the things I like about it, and Suzanne and I have talked about it, and I know that we both appreciate this feature, is if you look over here, you can see not only is it giving you the numbers of where you can reference, if there's images, if there are videos, it's going to put all of that together in one place as well. So I find it a really nice curation place to start from if I'm looking for things. And I saw that there was one more question that came up in the
Thank
chat
you.
that said, so and I apologize if I say your name wrong. I'm gonna say Mirka. I hope that that's right, or Mirka. It says if the physician with the financial relationship cannot serve as a planner, is that true? That is what Perplexity's recommendation is based on its understanding. You still have to decide if that is actually accurate or not. So unfortunately, it is not going to do away with us having to actually make the ultimate decision. What it does is it gives you a place to start from. So it gives you things to think about. Are there any other questions so far? No. Okay. So what I'm going to do then is we're going to go to the next prompt. Okay. Oh, actually, this was yours about the interview questions.
Yeah.
Okay. All right. So we'll go, Suzanne's got one more, and then I think I've got another example of mitigation. And then I use this a lot. One of the if you look at what the compliance data is for both ACCME and joint accreditation, because we're jointly accredited, it's that program analysis part that seems to be a large area of non-compliance. It's why we focused on mitigation and evaluation, is because those are the two areas that seem to be non-compliant a lot. So we'll give a couple examples for those. But Suzanne also had a really good case about how used it to conduct some interviews.
So I am relatively new at having to do interviews. Not sure what questions to ask, what's relevant. So what I've done here, I gotta minimize that again. I can't see my, there we go. Okay, so. Nope, that's okay. So I'm going to feed in the position job description and points from the applicant's resume. And then ask it, what questions can I ask this person? So we will, this is again, another long one. I can't do anything short. Okay. Okay, so let's copy that. Didn't do it right. There we go. Okay. I'm still learning how to use the keyboard. I'm used to a mouse. Let's see. We're going to paste that in there. This is an actual job description and an actual person's resume. Full disclosure, it's part of my resume. I didn't want to use anything from anyone else. So here it's saying, based on what you've uploaded, here's the different questions you can ask. Again, you don't want to just copy and use all these questions. You want to likely rephrase at least some of them. Some of them are pretty good. But it'll give you a whole list. I did this, we were doing interviews for different positions within the university. And I wasn't sure exactly what to ask. Again, I'm new at that. So I went ahead and fed in information and said, what relevant questions can I ask this candidate? And it came back with quite a few good ones, which I modified and then submitted to our committee. And we used quite a few of them. And again, it's going to give you the sources where it's taking this. If you click here, it's saying that there's more sources. So you can click on any of those. But that's just a quick down and dirty way to figure out how to ask questions or different things for candidates. So I'm going to switch back to Laura, who can go back.
Okay. And I'm gonna again look in the chat, see if there's any. Oh, okay. So Robert says, I use the CMS Open Payments website as part of the database for looking for potential conflicts of interest. That's a good place to go. And wonder if this is part of the database that AI automatically uses. That I can't tell you. That is one thing that nobody has the ability to see. They do not share where they're actually pulling the data from. However, what I would say is that what you can do is when you write your prompt, put in that you want it to look at the CMS Open Payments website and give it that link. And then it will, if it's open access. Now, if it's behind a firewall, there's nothing that it's not going to look at stuff. Theoretically, it's not supposed to look at stuff that's behind a firewall. But if it's open access and you give it that link, then it should look at that site for you.
And verify that when you ask the question and you put the link in, look at the references that it's showing and make sure that what you're asking is there.
Particularly with Perplexity, it'll give you that reference point to see if it actually did it. And then Michael has asked, could this platform be used to verify presentation materials, slide decks to ensure learning materials content meet the standards and criteria set by ACCME?
Absolutely.
So yes, it can. However, you are correct that if you are going to upload a presentation on an open access AI, you should let them know. There's nothing that says that you have to let them know, like there's no law against it. And I don't think that there's any guidance from the ACCME. However, it is best practice if you're going to upload something that is somebody else's material or has their name on it to an open access AI, you should let them know. So in a case like you're describing, Michael, that's where I would use Copilot, because I know that the institution has paid for it and it's encrypted. Even though I don't necessarily like it as well as Perplexity because it doesn't give you those reference points, it's still going to be my preferred method just for the security. Any other questions before we move on? I know we've got, how much time? We've got 20 minutes. Yeah. Okay. All right. So what I'm going to show you, I don't think I had a mitigation example as well. I think I'm not going to do that just so we can get into the evaluation a little bit. So what I'm going to show you here, and I'm going to talk through the prompt a little bit first, and then I'll show you how we actually did it. So when you do the program analysis, you know that we have to think about, I think almost everybody probably has like an open-ended question about thinking about the knowledge and skills you learned. Please describe the most important things you plan to apply to improve your practice. Like I said, we're jointly accredited. So when we do that program analysis, it needs to be about the healthcare team more than just the individual. So for my prompt here, I have asked it about the healthcare team's practice and performance. And I also gave it a specific rubric of what I want it to measure against. So what I specifically asked it is to provide feedback using, and there's 4 competencies that healthcare teams look at. So I did values and ethics. I actually defined it. Same thing for roles and responsibilities. So there's 4 of them there. The other thing that I started to ask it to do is that I want to ask it to do a summary of how many times that theme has been mentioned and give me a couple of examples of what its sample direct quotes are. And that way I can better judge whether or not I actually think that it's doing what I want it to do. And this is what I do through chat. I do find that chat is a little bit better at the program analysis and is a little bit better at, again, wordsmithing than Perplexity is. Perplexity is okay, but I think this is better. So what I do, and you're going to see me go into here a little bit. So we put these together for you. So we actually have the open-ended here. I'm going to make sure that this is actually the right one. Oops. Let's close those. Yeah. So you'll see here what we did is we took what we asked through our electronic surveys, and then we put this all in here in one Excel document. So this is another thing, if you're going to do programmatic analysis and you use Excel documents, the more columns and the more data that you give it and you ask it to do more with it, the more chance it has to make a mistake or time out, because sometimes it does time out. So what I do, this is part of a much larger database of downloads that we get from our surveys. I only want it to look at this open-ended question. So all of those other columns I take out. And all I'm uploading to chat is the data that I want it to use. So you'll see, I'm going to close this here. And then if I go into chat, so where in Perplexity, it's a paperclip, in chat, it's a plus sign. And you can upload from your computer. You can see all the things that I have open on my desktop too. I use my desktop a lot. Let me get this. Okay. And you'll see that that it's uploaded. Then I go back to the prompt. And the other thing that I did is there's actually a PDF that has been created from the it's IPCE, Interprofessional Education Collaborative, of the core competencies that they use. So I've actually referenced that as well. So I'm going to put that in here. And then you'll see. So when it's here, what it's basically doing is it's showing me the Excel document that I put up. So this is basically the data and the prompt, and you can see that it's analyzing it. And this kind of analysis will take a little bit longer than if you're just asking a simple question. And hopefully it will take too long, or we'll just keep talking about other things. Oops, sorry. Oh, like stuck. That's my phone. Okay. So here it goes with the summary. So you can see here, it tells me what each of the areas are, what percentage of responses fit in that area, what the rationale is, and the sample comments. And so what I would do is I would look at that and particularly look at the sample comments and see if I think that I agree with it or not. If I didn't agree with it, then I would ask it some more questions. And then what I do from a follow-up is I want it to put it in a visual that I could include in a PowerPoint presentation. So I'm going to ask that question for it. Now, I will tell you that's another area that Perplexity is not as good at. If chat is pretty good at being able to put visuals together that you could decide that you want to put in a PowerPoint presentation, Perplexity is not good at that. I actually tried it the other day. It doesn't allow for downloadable information very much. So here, here's what it suggested for a graph, and I could say, can you do this as a pie chart? And there you go. It does it as a pie chart as well. And then you can see here where you can actually download that to be able to put into, again, a PowerPoint presentation or something. And then I can show you some comparisons that it does too, but I want to look at the chat and see if we have any questions. It looked like we did. Oh, Joe said, thank you very much. Very helpful. Okay. Any other questions on this part of it? Or anything so far? Are you guys thinking, and you can go off, you can unmute yourselves if you want to. Have you thought of any use cases for yourself just by what we've been talking about so far? You can either put it in the chat or go off mute or unmute yourself. Nothing?
I think the last thing, making a chart and playing around with different types of charts to see what seems like it would be the
Yeah.
most useful. What is it? I always think it's interesting to look at what a pie chart versus a line chart or a bar chart emphasizes. So it seems like this is
Yeah.
a really quick way to compare them and look and see.
Yeah. The other thing it's really good for with individual activities is you can also ask it to do thematic analysis a lot. So a lot of times, in the beginning, when I was first starting to do that, I would just say, can you give me the themes that you see? I've started narrowing that down. So I'll say, give me the top 5 themes. And again, how many times did you use it? Have I received any feedback on using this for program analysis? You mean like official feedback from like the ACCME or just feedback in general? Official. Okay. So I have not received any official feedback on it. However, we did just finish going through our reaccreditation. And that's what we used from our programmatic analysis. I used it for our 2023 data, and then I went back and used our 2022 data and did the same thing. And we did get commendation, so I'm assuming that they thought it was okay. But in terms of any exact feedback, we haven't really received anything. I think usually as long as it makes sense and you can explain what you're doing, they they'll use it. I think if I had just said that we used AI to analyze, it would not have been as acceptable, but because I'm specifically using the interprofessional collaborative practice competencies, this is why I'm using them, and this is the question that I asked. Like getting into that specifics about how you're analyzing and why you're choosing the methodology that you are. I think that's the important part, whether you use AI or not. AI is just a tool that you're using to help with that. So I think, what time is it?
We've got about 9 minutes.
Okay, so I think I've got time to show you one more example. So another thing that we did is, oops, sorry. We went through and we looked at at all of our spreadsheets to see how much were planned for the team by the team. So we had multiple credits versus one credit type. So if I go back to here, we're going to upload a new spreadsheet. And this came from our PARS report. But again, I only put in the columns that I knew it was going to have to use. I'm very big about not giving it more data than what it actually needs. And then the prompt I did was asking it to tell me how many rows indicated that they offered more than one credit type. And I'm telling it where it can get that data. So in columns E through N, it would have a number that was greater than 0. And I'm going to look at the chat while this is analyzing. Is there a way to utilize AI to identify practice gaps? Oh, we have not talked about that, but absolutely you can use AI to determine practice gaps. And that, Robert, if you go back to the recording of this, and the beginning, we talk about the difference between using Perplexity and chat. I would use Perplexity for that. And so what you can do is you can ask it, I mean, there's all kinds of ways that you could use it to help identify practice gaps. So you could ask it to look at some sort of open access database that you know information comes from. You could ask it, what are the top, I don't know, what's the best current management for eosinophilic esophagitis? You know, that's very specific, but we have a clinic for there. And I was looking at that earlier today, so that came to mind. But you can ask it all kinds of things related to the practice gap. And the good thing about using Perplexity is it's going to tell you the resource that it's going to be able to see if you think that they are sources that are credible. But absolutely, I would use it to identify practice gaps. It's a great tool for that. So if you look at here, it analyzed the data that I had, and it said that that there are 688 rows that indicate that we did not specify that it was IPCE credit. However, it had multiple credits that were offered for the activity. So the reason I would ask that question is, for me, it's like, it's a good place for me to start to say, okay, out of those activities, there were multiple professions that attended. Why was that not for the team by the team? Is there a way that we could make that better team-based education? So that's a reason that I would ask that question. So we've got 5 minutes. Yeah, we've got 5 minutes left. I want to make sure that we get to any other use cases that people are thinking of that maybe Suzanne or I could give you some advice on, or if we've used it. Any other ways that people are thinking about using it? I can't tell if people are typing. I miss seeing the little dots where you can tell if people are typing something. So let me ask you to put this in the chat. Did this inspire you, or did it intimidate you to actually try to use it at some point in the next week? You can just put inspire or intimidate. Oh, that's good. We got a couple of inspires. Good. Oh, a little bit of both. Ah. I like the inspire with caution. Good. I would well, if you tried, I'd love to hear how it actually went for you. One question that did come up here that says, can you use it to determine if you met your mission? Absolutely, you can, depending on what your mission is. Now, if your mission is really, really broad and it says something like we intend to improve healthcare, it's gonna be a little bit difficult to use it. But I think that's something where you could actually kind of brainstorm with other people, with some of your CME leadership, or if you have a committee that you work with, and say, okay, what kind of questions, based on the data that we have access to, what kind of questions could we ask it in order to be able to say that we met our mission? So you absolutely could do it. Robert says, I assume we always need to specify in our CME program documentation that we have used AI for the various purpose you described today. I don't know that there is actually any requirements for that. I know when we did our self-study, I just added a line to say I used AI to help do the analysis, and here's the questions that I asked. So
There's nothing formal.
yeah, there's nothing right now. I'm guessing guidance will probably come at some point in life. Right now it's not. But I think best practice is to do it. There was a comment to say I'm a little hesitant because we still need to verify the information AI is providing. It's true, but again, a lot of times with Perplexity, if you click on the link and you say, oh yeah, that is a good resource, and I do agree with that, that's all there is to it, as opposed to you having to Google search all over the site to find what you want. I find it still to be a real time saver.
It's a resource, not an answer.
Yeah. If you couldn't hear that, Suzanne said it's a resource, not an answer. I think that's a good way to put that. Okay, but I think we're just about at time, right? Yep, 3:58. Any last minute questions that people have, or something that they want to see? And I will tell you, I also use it personally as well to say, what are the best restaurants in Cincinnati?
Can literally ask
Yeah.
it anything. I use it for Excel. How do I write this
Oh,
formula?
actually, do you know what, Suzanne? I couldn't hear that. Suzanne mentioned a really good thing, because we started doing that too, is asking if you can't figure out like a formula that you want to do in Excel, ask chat. Or actually, I usually ask Perplexity, because Perplexity will then take me a lot of times to videos to show me, or step-by-step instructions. But I used it the other day to tell me how to do something in Microsoft Forms because I couldn't figure it out. There's really a lot of use.
I used it to figure out what was wrong with my printer.
There you go. Any other questions? Okay. Well, I'll stop sharing. Ruth, was there anything else you want to sign off to people or say?
No, well, thank you very much for your presentation. I think at least if you didn't know anything about AI, you got a little bit of an idea of how to use it, and basically you can use it for anything. So
Yep.
especially with the CME program to help manage some of the data and get some answers.
Great. All right. Well, thank you very much. And like I said, if you guys use it and you have some success or have any questions, feel free to reach out. Thanks for having us. Bye.